The U.S. Centers for Disease Control and Prevention (CDC) has introduced a novel preventive measure to combat severe respiratory syncytial virus, RSV, in infants. The CDC now recommends that all infants under 8 months old receive a new antibody shot to shield them from RSV. This directive comes after a unanimous decision by the Advisory Committee on Immunization Practices, ACIP, an independent expert panel that advises the CDC. ACIP has also advised a secondary dose of nirsevimab for specific infants aged 8 to 19 months who are at higher risk for hospitalization due to underlying health conditions during their second RSV season. RSV, a virus known for targeting the lungs and being a primary cause of infant hospitalization, particularly among those under 1 year old, poses the greatest threat to younger babies. The freshly recommended nirsevimab antibody shot, which is distinct from a vaccine and functions by preventing RSV infection of cells, has garnered considerable enthusiasm for its potential to significantly reduce hospitalizations and safeguard vulnerable infants. Notably, certain racial and ethnic groups, such as American Indian and Alaska Native children, experience disproportionately higher hospitalization rates due to RSV. Hence, the CDC has extended the recommendation for a second shot of nirsevimab to cover these groups as well. This innovative intervention, marketed as Befirtus, constitutes the initial form of passive immunization to be included in the childhood immunization regimen. Passive immunizations differ from vaccines in that they involve introducing preformed protective antibodies into the body rather than stimulating antibody production. Both Sanofi and AstraZeneca, the pharmaceutical companies responsible for nirsevimab, anticipate its availability within a few months, coinciding with the imminent RSV season. The ACIP's endorsement ensures that this therapy will be accessible to all infants without imposing any out-of-pocket expenses on families, in line with the provisions of the Affordable Care Act. While there might be a delay in insurance coverage implementation, the ACIP's recommendation ultimately paves the way for broader access to this preventive measure. Clinical trials have underscored nirsevimab's effectiveness in substantially reducing the likelihood of RSV-related hospitalizations and intensive care requirements for infants. Timely administration, closely aligned with the RSV season, usually between October and March in the US, is deemed crucial. The CDC advises administering nirsevimab during the first week of life for infants born during or just prior to the RSV season. Likewise, infants under 8 months old, who haven't received the shot, should get it shortly before the RSV season. Moreover, babies aged 8 to 19 months with underlying health vulnerabilities are advised to receive a second dose for protection during their subsequent RSV season. Experts widely concur that this recommendation represents a notable stride in preventing severe RSV ailments in infants, thereby alleviating pressure on families, medical facilities, and the healthcare system at large. Stay tuned for more insights into the world of scientific discovery and preparedness. Subscribe in our channel.